Lung cancer are growths that develop within the lungs, either from the glands of the lungs, the lining tissue of the lungs, or the nerve elements of the lungs.
Most patients come in after they've had difficulty with their breathing. They coughing up blood, or they're short of breath, or they have some pain in their chest.
It's common for patients to think the situation's hopeless, and one of the most important things we can do is explain to them that there are treatments available and there are things we can do, and sometimes get really amazing results that they don't anticipate.
Whenever we're approaching a patient with lung cancer, we realize that it can be localized or it could have spread. If it's localized, you're really spending a lot of your effort at getting rid of the initial mass, which can be either with surgery or with radiation therapy, and either of those can be combined with chemotherapy.
Most of the patients come to us with some sort of tissue sample showing lung cancer. We may assist in getting further studies to determine their staging, to determine their prognosis before we start treatment.
After it's been decided how to treat the patient, the first step is the patient comes in and gets a CAT scan. Every office has its own CAT scan machine, the CT scan machine, where the patient lays down, and we do usually 3 different CT scans through the breathing phase, because a lot of lung tumors can move during breathing and during the treatment, so we have to know exactly where they are. That gets sent to a computer and we figure out how to aim the beams.
It's important that the physician treating lung cancer with radiation therapy has the appropriate equipment, because there are a lot of important structures in the chest, and you want to be able to hit the lung cancer and avoid the other critical structures.
Radiation is a non-invasive modality. It's actually an X-ray. So there's no pain, you cannot see it, you cannot feel it, you cannot taste it or smell it. And it has a very high potential at eradicating tumors when delivered accurately.
The traditional treatment for lung cancer is external beam radiation therapy, and external beam radiation therapy is using X-rays that are highly focused at the tumor to treat the cancer from the outside. It traditionally is done over a 5 to 6 week period, 5 days a week.
Right now we're more precise in the way we deliver the radiation. We use something called IMRT, which stands for Intensity Modulated Radiation Therapy. The advantage of doing IMRT over conventional 3D conformal radiation is that we're able to spare normal tissues.
For patients with very limited disease who either don't want or can't, because of medical reasons, undergo a surgical resection, we offer stereotactic radiosurgery. This allows us to give a very focused, intense dose of radiation just to a small spot within the lung and eradicate a tumor that way with a very, very high success rate and limited toxicity to the patient.
Once the patient has had a plan chosen, then they come in every day for treatment.
How are you doing today?
They lie down on the treatment table, and our treatment tables are very sophisticated now, and we take X-ray pictures to make sure they're in exactly the right position. Since the development of these machines that can deliver these high doses of radiation, the toxicity of the treatment has gone down, the time of the treatment has gone down, and the efficacy of the treatment has gone way up.
Radiation will shrink that tumor, open up their airways. It'll also dry out that tumor so that it minimizes any coughing and improves their breathing status throughout treatment.
I'm pleased that I can look at patients, I can look at family members, and I know that they've come to a facility which gives them the best chance of getting cancer care at the highest quality that can be delivered.